we are here again at WHX 2025, and I have the honor of sitting with Dr. Koku Awoonor, who is representing the Ministry of Health Ghana. Thank you so much for being here. We are honored to have you here.
Pleasure, my pleasure.
Tell me, how does it feel to be representing the Ministry of Health Ghana at this year's WHX?
It feels great, and I think I'm privileged to be here. Very exciting moment to see all this, happening here in terms of healthcare industry, technology, and everything. So I'm very, very honored to be here, and it's an exciting time for us.
Yes, and we're very excited to have you here. Tell me, so far you've been here for the 2 days. Tell me, what are your impressions of WHX Miami as a platform for collaboration?
Amazing. Maybe I would say amazing because my expectation was not to what I've seen. I've seen more than I've expected. To see the diverse, industry play here, very, very overwhelming in terms of what is being displayed here. I think it's good for the healthcare industry. And to be honest with you, I've not imagined that so much is happening in the healthcare industry.
Yeah.
When you sit in your corner, sometimes you try to
Hmm.
be content with all you have, but there's so much.
And this is a huge expo. The floor is, yeah, it's impressive.
So very impressive.
Yeah. Tell me, in your view, how can global health trade shows like WHX Miami help support development in countries like Ghana?
Oh, no, this is absolutely, there's a huge opportunity. Huge opportunity. I mean, Africa, you know that even though it's a growing healthcare industry, there is still gaps that needs to be filled. If you look at our healthcare system in Africa, and I'm making particular reference to Ghana, you realize that it comes from the community level, which has its own needs. Then you have the district level, the national level. So for me, this creates an opportunity for us to not only to explore, but to see what is available there and how can these fit into our healthcare system. So for me, with this kind of show, it provides Ghana opportunity, and not only Ghana but the rest of Africa, which I feel I represent in a way. Taking advantage of this and seeing what needs to be explored to be able to, get that technology back into the African healthcare system.
What role do you see for public-private partnerships in strengthening healthcare infrastructure in Ghana and across wider regions?
Well, the role of private sector in healthcare development is very, very important. The public sector is also important, but that synergy between public-private partnership provides a great opportunity for us to develop a healthcare system. A lot of the healthcare industry operates in the private sector. That infrastructure, technology, equipment systems, if it's aligned to the public sector, I think will really create, an opportunity for more improved healthcare system. A lot of finances in healthcare delivery is in the private sector, and sometimes the public sector may not necessarily have all that it takes. And in most countries in Africa, for instance, in Ghana, for instance, you will see the private sector playing about 45%, 40% of the role in the healthcare industry. The public sector play about 60%. There's always been a disconnect between what the private sector does and what the public sector does. I see a great opportunity, particularly in this show, where you see a lot of private players
Right.
bringing that to the public sector. I work in the public sector, and I can already see those opportunities, those roles. That role will form into how can the private sector work with the public sector to be able to, improve healthcare system. So I see a very important role, and I see that role coming to improve healthcare system in no small way. And I think that we need to start beginning to think around what that particular relationship will be. How do we factor that? And I mean, we have some ideas around what that can be.
Right.
So there are new thinking, new ideas as to how the public sector or the private sector can actually work with the public sector. And most governments, I would talk for Ghana, for instance, that the government in Ghana is actually looking for such opportunities. So for me, being here also provides me
Yeah.
that, space to be able to see
Of course.
and explore. Yeah.
Wonderful. Are there specific areas within Ghana's health system, such as digital health, diagnosis, or maternal care, that with international collaboration would make the biggest impact?
Absolutely. I mean, I think you have hit the head on you have hit the point that I really wanted to make. There are a lot of innovations, a lot of development that drives from the private sector. Digital health, AI, imaging diagnostics,
Yeah.
capacity building for biomedical engineering. These are mainly things that you see in the private sector. For Ghana, for instance, if you look at areas of diagnostics or even laboratory science, for instance, there's a lot of capacity and investment in the private sector. You may go to a facility in Ghana, for instance, when it comes to diagnostics at the public sector, they will refer you to the private sector.
Right.
Because that's where the investment is, that's where the equipment are,
The technology.
So that is the areas that we are looking at. Not only infrastructure, you can have a hospital, for instance, a public sector. You can have a private sector who is setting up a laboratory or diagnostic imaging center within the public space to be able to provide that services. Kind of a win-win situation.
Of course.
But also, what it does is also that it makes it less cumbersome for the patient. So these are areas that we need to explore and that are really needed in terms of diagnostics, infrastructure, for instance. Where the capital is within the private sector, bringing that on board to the private. The government, for instance, public sector can provide, the environment, the support system.
Right.
But if you want to make a real investment for that symbiotic relationship for improved health system, then I think you have to bring in these areas that are very important in diagnosis.
In order to make a valuable impact.
A valuable impact, yes, absolutely.
Right.
Yeah.
How important is the access to emerging technology for improving the health outcomes in Ghana? And how do you think that an event like WHX Miami help accelerate the access?
I think that is what is being demonstrated here. Access is limited. If you take Africa, I take Ghana, for instance. The big players are in the private sector. How do you even have a conversation with the big players? It's fairs like this, WHX Miami.
Right.
So for me, this is where you need to network, to have that partnership and see, once you identify those areas that needs to be explored, you can start building bridges from here.
Yeah.
So I see this fair, WHX Miami, providing the platform now. I'm here for the first time to see this kind of, I'm highly impressed. And I think that the reason why I'm here is being demonstrated, showed here.
Yeah.
So I think that partnership is clearly what we need to see.
Yeah, I think WHX Miami does a really good job of kind of leveling the playing field and getting everyone on common ground and to be able to
And I
communicate
can see the
and collaborate.
diversity
Yeah.
in terms of what is needed. I've gone around today, I've seen so much, and I think I'm really amazed.
Amazing. Tell me, what are some of the ministry's first priorities when it comes to improving equitable healthcare delivery, and how can global health communities contribute to this goal?
Yeah, for us, there is inequity, I would say, in the terms of, in the various areas of healthcare system. The community level, the big players will be in the capital city, diagnostics, laboratory services. There's a lot of referral that move from the lower level
I understand.
to the higher level. I see the opportunity where we are, both the public-private partnership is not only going to be limited to the cities. we need to start developing our healthcare systems from the community level.
Of course.
Basically, what is needed there needs to be provided. And it is important to realize that you're going to have that investment to partnership with the private sector. So we have opportunities in terms of diagnostics. We have opportunity in terms of equipment, in terms of infrastructure, basic things that needs not only to be at the national level, but also at the community level. And I
Right.
think that is where we need to also be thinking through as we develop this kind of partnership, so that we create the equity, so that you don't get somebody being referred to the city because the person needs to just do
Right.
an X-ray.
Hmm.
Okay, but that facility is also available at the lower level. Again, it comes about the equipment, the
Right.
provision, the
Being
training,
accessible to everybody.
accessible, yeah, to everybody.
I understand. Tell me from your perspective, how can industry leaders and innovators ensure Tell me from your perspective, how can industry leaders and innovators ensure that their solutions are inclusive, affordable, and scalable for emerging healthcare systems?
I think the industry players needs to understand our healthcare system. One size cannot fit all. And the way I see that happening is the discussion, but having a local understanding and context of what our system is. And that's where, again, the partnership is very important. You may need, for instance, to provide an equipment, right?
Mhm.
Within the context of a local environment, there may not necessarily be electricity, for instance. So
Right.
are we talking about solar? But you can have a system that is developed for electricity in mind to drive a solar system. So when I talk about the context, and of course the environment, the context, the culture,
Mhm.
I think that the local presence of seeing what the system looks like is very important in designing this kind of equipment, infrastructure, etc.
Right.
I think that's the only way, because once that is done, then you can really address the local need. So we cannot say that of course, we have all this equipment, everything is working well, but we need to also understand how the health system itself works. What it means is that local presence of manufacturers, producers, private sector needs to be felt at the local level, so they can really innovations in terms of development council, all of that.
Yeah. Yeah. Thank you for that. As healthcare becomes increasingly global, what message would you like to share with international stakeholders about partnering with Ghana?
Oh, I mean, I think we have to start from some discussion, a discussion of what the needs are. We need to also do a lot of work in understanding what our gaps are and how those gaps will be filled.
Mhm.
That is where we start from in terms of making our own internal analysis of what the needs are. I mean, let me just make an example of Ghana, for instance, where we have a lot now in terms of burden of disease
Mhm.
in non-communicable diseases. So we're having a lot of cardiac diseases,
Right.
tension, diabetes, renal diseases. Let's take the case of even dialysis.
Mhm.
Innovations in providing dialysis services. So you need to make sure that you partner and create the space for people to have dialysis. You do not have to and address issues of inequity. So you have a place where you have more dialysis centers. Ghana is moving to a place where a lot of emphasis is being placed on non-communicable diseases, chronic care, etc. And I think that is where the emphasis should be. And I'm saying this because if you look at burden of disease profile, not only in Ghana, in Africa, it keeps changing. And I think that information is very important to design a healthcare system that addresses, particularly when you are talking about achieving what we call the universal health coverage. Yeah.
Oh, wonderful. Finally, my last question. what would you like to take back from WHX Miami to reform, inspire future healthcare strategies in Ghana?
Well, I mean, Ghana, our interest is in public-private partnership. And I see a lot of industry players here who are doing innovative things. And this morning, I went around many of the stands and I've seen the innovations, the kind of things that really we need. What I'll take from here is to begin a dialogue of the private sector,
Yes.
of the industry players, but also try to see that vision not only for Ghana, but the added value of how do I bring on board other African global leaders
Yes.
and healthcare managers to be able to come and also do that partnership. Then we will have
Yes.
a bigger effect and effort. So I look forward that within these 3 days, what I'll see here, and tomorrow, for instance, I will still be having a lot of discussions
Right. Of
with
course.
other players. My vision is how do I take the lessons from here and share it with African leaders or colleagues so that we have a bigger picture, but then also bring them on board. But also, how do we also make sure that at least we engage more with the private sector,
Right.
that we can work together. So I look forward to more of this engagement. I look forward for, as an advocate, for instance,
Of
for
course.
public-private partnership, engagement
Yes.
to be able to drive the healthcare system in Africa, not only in Ghana, but in the rest of Africa.
But in all of Africa, yes. Well, this is certainly the right place to do that. So I hope you enjoy the rest of your time here and your next day. And thank you so much, Dr. Awoonor, for sitting with me and for
the
taking
last
the
thing I
time.
want to say is, as I'm sure you are aware, that the next expo is in Ghana
Yes.
in November. I'm looking forward to participating. Not only me, but the rest of my minister, my
Yes.
colleagues, and across the sub-region, get them to be part of the next expo in Ghana, so that we can have that critical community of healthcare leaders that wants to use the opportunity to build our healthcare system. So that is what I'm looking forward to.
Wonderful. And we are excited to be in Ghana. We're excited to be going there. And again, thank you so much for your time. And thank you for
forward to
making
seeing
it
you.
all the way out here. We look forward to seeing you and at the next WHX Miami and next year.
Yeah, absolutely.
Thank you.
Thank you.